Hello everyone. Welcome to Krityan Academy, number one medical coding institute. Today the topic is on pacemaker and ICD, which is implantable cardio defibrillator, and the CPT code ranges from 33202 to 33249. So we'll see the difference between what is pacemaker and what is ICD, and what are the codes. Usually this will be having for insertions, removals, and also the leads. Okay, so let's begin with this. Firstly, what is a pacemaker? All right, so if you see here, what is pacemaker? A pacemaker is a small battery operated device implanted in the chest or abdomen to treat abnormal heart rhythms, which is commonly known as arrhythmias, by delivering electrical impulses to regulate the heartbeat only. So the main function of this pacemaker is to regulate the heartbeat, because they are having abnormal heart rhythms, which is arrhythmias. By delivering electrical impulses, it will be regulated to the heartbeat. So to regulate the normal heartbeat. And this device monitors the heart 24 by 7 and sends an electrical signals to make the heartbeat faster or more consistently when it senses a slow or irregular rhythm. Hope you understood, right? The function of pacemaker is here. You can see when the heart is beating very slow or irregular rhythm, immediately this will send electrical signals, and immediately it will send the electrical signals to make the heartbeat faster. So this is a pacemaker. And what is ICD? Implantable cardio defibrillator. An implantable cardio defibrillator, ICD. This is also a small battery powered device that this is implanted under the skin, under the skin. You can see here, this one is on the chest or abdomen, and this one under the skin, it usually below the collarbone to monitor heart rates and prevent sudden cardiac death. So it detects the dangerous rapid arrhythmias and delivers electrical impulses or shocks to restore normal rhythm. To restore what? Normal rhythm. So whenever the heart is beating very fast, rapid arrhythmias, and immediately it will deliver what? Electrical impulses or shocks to restore normal rhythm. So this is what the difference here, pacemaker and ICD. Pacemaker and ICD. Okay, implantable cardio defibrillator, and this is a pacemaker. Hope you understood the difference. Let's see exactly how it will be inserted. Here you can see the pacemaker, which is a permanent pacemaker. You can see they inserted the leads, which we can also call as a wires. And you will see this terminology in the surgery reports like RA, right atrium, LA, left atrium, right ventricle, and left ventricle. These are all the heart chambers. Here you can see. And it is a pulse generator. On the right side, you can see implantable cardio defibrillator, ICD. And here you can see that was placed under the collarbone here. This is a collarbone. And you can see here pulse generator, right? And they inserted the leads into the chambers. Pacemaker as well as ICD, implantable cardioverter defibrillator. And if you see some terminology here, a lead, it's like a thin, flexible wire that connects the pacemaker generator to the heart muscle only. So these are very, very important in order to you give the correct code for pacemaker or ICD. So you should understand what exactly the single chamber. So one lead in either the atrium or the ventricle and you can consider it as a single chamber. Two leads, one in the atrium and one in the ventricle. Okay, two leads. Biventricular is three leads, atrium, right ventricle, and left ventricle. So these are the terminology you may expect in, the questions in interview. What do you mean by single chamber, or what do you mean by, the dual chamber or biventricular? Here on the right side, you can see the image, single chamber. So they inserted in only that lead into the right ventricular. A lead is attached in the right ventricle. If needed, energy is delivered to the ventricular to help it contract normally. So single chamber, it might be atrium or ventricle only. Whereas dual chamber, here we can see that lead is inserted into the right atrium as well as right ventricle, and this is considered as a dual chamber. And biventricular device, here you can see three leads are inserted. One is for right atrium, other one is a right ventricle, and other one is a left ventricle. Got it. So these are the things you need to remember: single chamber, dual chamber, and biventricular devices, because the codes have been classified accordingly. Now let's see some of the codes here. If you see the ICD system insertions, one second, sorry, let's begin with pacemaker. So pacemaker initial insertion, that means the first time insertion, we have these set of codes, 33206 and the insertion of new or a replacement, permanent pacemaker with a transvenous electrode, that's only for atrial. You can consider it as a single chamber. Okay, so then you can consider it, you can use the code 33206 and 33207 is both are same, but the only difference, this is for atrium and this is for ventricular. And 33208 is for a new or replacement pacemaker with transvenous electrodes, which is atrial and ventricular dual chamber, 33208 only. And 33274, this is for transcatheter insertion or replacement of permanent leadless pacemaker and right ventricular. So this one is a leadless pacemaker only. So 33274. These are the CPT codes we'll be using first time inserting the pacemaker only. First time inserting the pacemaker. So same like this, we have a ICD also. In ICD, if they are insertion or if they are coming for replacement of permanent implantable defibrillator system with transvenous leads, either it may be a single lead or single chamber or dual chamber. So you can use the code 33249 and you can always see here single chamber is one lead in either the atrium or the ventricle. Dual chamber is two leads, one in the atrium and one in the ventricle. Biventricular means three leads only. So 33270, this is an insertion or replacement of subcutaneous implantable defibrillator system, including electrode and pulse generator. Including electrode and pulse generator. So subcutaneous implantable defibrillator system, including electrodes and pulse generator. And then here 33225 is insertion of only pacing electrodes, which is cardiac venous system for left ventricular pacing. So based on these chambers, you can choose the codes for ICD. You can choose the codes for ICD. Okay, implantable cardio defibrillator system. And that's for initial insertion. And now you can see this is only generator, the device, only the device, pacemaker replace, whether it is a remove and new. If it is a single lead, you can use 33227. If it is a dual lead, 33228 only. If it is a multiple lead, 33229. And pacemaker insertion only existing leads. So these two are for pacemakers only. And pacemaker insertion, they are only inserting the pacemaker only. Got it? With existing leads. Then we have for single lead, use this code. For dual lead, use this code. For multiple leads, 33221. And the next two are related to ICD. If they are doing ICD replace is nothing but removing and placing the new one. Got it? So then we have a single lead 33262, and for dual lead 33263, and for multiple lead 33264. And ICD insertion only, which is existing leads. ICD insertion only, existing leads only. Here, this is for only insertion, but this is a replace. Got it. Replace means removing the existing one and placing the new one. But here ICD insertion only, which is existing leads, single lead 33240 only, for dual lead 33230, and for multiple lead 33231. For multiple 33231 only. So these are the codes, whenever they are coming only for generator only procedures. That means only for the devices. The leads will be remain same only. Okay. Follow these things. Okay. Pacemaker replace, only they are doing pacemaker replace, which is removing old one and placing new one. If it is a single lead, use this code. If it is a dual lead, use this code. Multiple means this code. So this pacemaker and ICDs are all depends on the chambers, like which is single lead or dual lead or multiple leads. The next one, if you see this one, leads, procedures, and removal only. So we have seen initial insertion. Second one, we have seen the generator only procedures, and now which is a leads only. I already told you, right? The lead is a Y, right? So here lead procedures and removal. In case if they are doing repositioning of a previously implanted lead, that might be a atrium or a ventricular lead, you can use this code 33215. This is all about the leads only. And if they are insertion of a lead, a single lead only, which that might be a pacemaker or ICD. It may be a pacemaker device or ICD device. You can use the code 33216. And what about 33241? Removal of implantable defibrillator pulse generator only. Then you can use 33241 removal. And this is a removal of single or dual chamber transvenous pacemaker electrodes by transvenous extraction 33244. All these are removal only. But previous slide, we have seen that is a replacement, removal and replacement. That means removing and placing a new one. But these are only for removals. Okay. Now, then sometimes the patients will come for evaluation and programming only. So what do you mean by that evaluation and programming? So in person, the person is evaluating the device. If it is a single lead pacemaker or leadless system, use this code 93279. Other one you can see here, dual lead pacemaker system 93280. And this one is just the interrogation device evaluation without any programming. You can use 93288 only. So you may get a question in interview, what are the CPT codes we'll use for evaluation and programming of pacemaker or ICD? You can say from 9 series only, which is comes on medicine section. 93279, 93280, and 93288. Let's see some of the scenarios. Right. If you see here a scenario, a patient with a symptomatic sick sinus syndrome, which is a bradycardia, receive a new dual chamber pacemaker. So try to understand here, the patient is having a symptomatic sick sinus syndrome, nothing but it's a bradycardia, slow heartbeat. Got it? And he's going to take a new dual chamber pacemaker. So this is a insertion of a new pacemaker, right? So we have a code which is a 33208. This indicates insertion of new permanent pacemaker with transvenous electrodes, which is a dual chamber. It's clearly mentioned dual chamber. Of course, in the surgery report, they will mention whether it is to right atrium or left ventricle, like that they will mention only. Accordingly, you can consider that as a dual chamber. Here in this straight away, they mention dual chamber pacemaker. So we have the code 33208 because this is a pacemaker. If it is a ICD, we have a separate code for that. And scenario 2 days after a dual chamber pacemaker insertion, the ventricular lead is found to be dislodged and the patient is taken back to the OR operating room to have lead repositioned. So this is a repositioning, right? So which we can use 33215 only, repositioning of previously implanted transvenous right atrial or ventricular electrode, right atrial or ventricular electrode. Here, this is a ventricular lead, right? So we can use 33215, which is for repositioning. We have codes for pacemaker and ICD. You need to check whether it is initial insertion or they are coming for repositioning or removal or just the generator only procedures. Just follow these things. And the chamber, single chamber or dual chamber or biventricular ND. Just follow all these scenarios. And for more cases, you can please reach out to the below number. We will explain you the case studies also, including the surgery reports. So thank you for watching. Please stay tuned for more coding knowledge. 100% will share the knowledge. Please kindly share, like, and subscribe our channel. So there are more updates we will receive. Thank you, everyone.